Hi, I'm Dr. Christy Sutton. Thank you for joining me. Let's dive in and learn more about the important topic of kids' health. So first, the disclaimer. This is for educational purposes only. This information is not intended to diagnose, treat, or prevent diseases. So today we're going to be talking about a lot of important topics. We're going to be talking about kids' brain health, brain development, some genes that you can and should know about for kids, lab testing that you need to look at for kids, nutrition for kids, gut health, immune health, and much more. I think everybody here is going to learn something. So please stick with me for the next hour. I promise you it'll be well worth your time. So first, I want to start out with one of my favorite concepts, which is why I believe everybody should get genetic testing done. And I think the sooner, the better. I don't think people should wait until, they're a certain age to get genetic testing. And if you wait until your 5th, 6th, 7th decade of life, then that's better than never getting it done because there's still actionable things you can do to protect your health. Having said that, if you get genetic testing done on a child at an early age, like, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, up to 18, that's still a child, 17, then the earlier you do that testing, the earlier you can create a personalized health plan, the earlier you can start avoiding the problems that can really cause your genetic landmines to go off, and the earlier you can start creating a plan to avoid those genetic landmines, because we all have genetic landmines. And the more you know, and if you could identify them and know what they are and how to avoid them, the easier it is to avoid them and prevent them from going off. And the genes are what they are. A large part of not letting those landmines go off is your environment and how you tailor your environment to your specific needs. And there are a lot of different genes, and I don't want to go into all of them. If you've been following me and my educational program I've been creating for Systemic Formula, then you truly have probably learned a lot about a lot of different concepts. And I'm going to talk about a little bit of those today. But some of the most important genes that I think that people should get and look at a really early age are the ones that I have over here on the right, which is the ApoE4 gene, which is the Alzheimer's gene. Now, I don't think necessarily you need to go and tell your 4 or 5-year-old you have the Alzheimer's gene, because they wouldn't even understand what that means. But I think it's important to know. And the reason I think it's important to know is because people who have the ApoE4 Alzheimer's genes are less likely, they have a harder time recovering from head traumas. And they are more likely to have a prolonged leaky blood-brain barrier after having a head trauma. I'll talk more about this in my brain webinar in the future. But the reason I think everybody should know if their kids have the ApoE4 Alzheimer's gene is because it can help guide one as far as what sports are really the best decision for that kid to be in. For example, if you want to put your child into soccer, which is a huge head trauma concussion sport, #1 concussion sport for females, also very high up there for males. You want to put them in soccer, you want to put them in hockey, you want to put them in, football, you want to put them in some of these high risk concussion sports. It would behoove you to know if they have that Alzheimer's gene, which is going to make them more likely to get concussed, less likely to heal up from their concussion. And with each concussion, they are more likely to develop Alzheimer's disease. And so then, for example, if I had a child that had that gene, then I would lead them more towards a low concussion risk sport activity, such as tennis, golf, swimming, etc. So that's a gene that I think one should look at so that you can create an actionable plan early in one's life. I have had patients that were in high school and their family did genetic testing. They found out they had 2 Alzheimer's genes or even 1 Alzheimer's gene, and they decided they didn't want to play football anymore. It was just not something that they cared enough about to continue doing. So, knowledge is power. What you choose to do with that knowledge is up to, the individual. But having that knowledge at least gives somebody the information to create an educated choice. Now, another gene that I think it's important for us to know about in our kids, and in adults as well, especially pregnant women, adults, or women that are going to be getting pregnant, is the MTHFR gene. Why? Because this gene, if a pregnant woman has this gene and is taking the methylfolate that their body doesn't naturally make as well, then they are less likely to have a child with some of the health problems that MTHFR can cause, which are vast. And a couple of those problems are things like birth defects, spina bifida, where the spinal cord doesn't close all the way, the autoimmune disease, neurological problems, cardiovascular problems, pregnancy complications for the woman during pregnancy. They're more likely to have eclampsia, preeclampsia, just problems in general, and autism. So, for example, a woman that is taking the correct methylated vitamins, if they have this gene, are less likely to have a child with many of these health problems because they are able to properly methylate. They're able to bypass their issue of not properly methylating B vitamins. Now, it's really important that they start taking those even before pregnancy, because that neural tube closes very early. I know this is not about pregnancy, this workshop, this webinar, but you can't really talk about kids without talking about pregnancy, because, it's kind of like necessary. They are required for each other to occur. So a healthy pregnant woman is more likely to have healthy kids. So if you really want to make sure, it's never too late to start supporting your child's health. But if you really want to make sure your child's healthy, start with, long before you get pregnant, making sure you have plenty of nutrients, methylated B vitamins. I'll talk about more of those nutrients as we go through this next hour. So another gene that I think it's really important to discuss, to know if you have these genes, is there's many glutathione genes that can decrease your ability to recycle or make glutathione, which can hinder your ability to detoxify certain things. It can create more oxidative stress, lower levels of glutathione, just more issues as far as glutathione-related issues. Now, we know that if you're low in glutathione, you're more likely to have issues with autoimmune diseases, oxidative stress, inflammation, general poor health. And these are things that you can support with nutrients. So it's helpful to look at these genes, maybe even order a glutathione lab test. With the MTHFR gene, order the homocysteine, especially in adults. You're not going to see a low homocysteine or a high homocysteine on kids, most likely, even if they have those genes. Kids tend to have lower levels of homocysteine. That doesn't mean that they don't need those methylated B vitamins still. So, just make sure that if you're supplementing, that they're getting a methylated form of the B vitamin, especially methylfolate. Now, and I discussed that gene more in my book and other workshops for systemic, so I just wanted to briefly talk about it here. Now, another set of genes that I think it's really important to know about when you're young, when one's young at any age, but especially at young, are the hemochromatosis genes. And this is something that, I am about to publish this book on iron, where I talk about these hemochromatosis genes, and it's called the iron curse. And the reason that I include these genes as important to know about as a child is because children can have hemochromatosis. I have diagnosed a 5-year-old with hemochromatosis. It was destroying her nervous system. She was reverting back to diapers, could not walk well. She was just fatigued all the time, sleeping all the time. And once that hemochromatosis was corrected, she quickly improved. It's a long story. I'm not going to be able to cover the whole story and the time with you today. My point is that hemochromatosis does happen in young kids. It's called juvenile hemochromatosis. It's almost always hereditary from these genes. These genes are very common. 30% of the population has at least one of these genes. And it's key that we are screening for these genes and looking at iron levels closely. In my opinion, and I'll talk more about the iron piece today, but full iron panels need to be done on everybody, regardless of age, but especially from your two-year-old on. Now, as an infant, you could get like a serum iron just with a prick. Once a child is 2 years old, you can do more thorough blood work. And in my opinion, you should be. I know a lot of parents are not completely on board with that, but it's important. And I think that we need to normalize that because a lot of things are getting missed that shouldn't be getting missed, including iron-related issues such as high iron and low iron. The next set of genes that I think are really important to look at in kids are the celiac genes. I'm not going to go into great detail about the celiac genes today because I've done that in other workshops. Having said that, you need to know about these genes because if you have one of these genes, you are more likely to develop celiac disease. 2/3 of people with celiac disease do not have digestive issues. A large number of them just have neurological issues because their autoimmune disease is manifested as their immune system attacking their nervous system when they eat gluten, rather than their immune system just attacking their digestive system. Or maybe their immune system isn't really attacking the digestive system at all. It's just attacking the nervous system or the skin or whatever. So celiac disease is a clinical chameleon. Hemochromatosis is a clinical chameleon. These are things that commonly don't get diagnosed. There are strong genes for them, and they need to be looked at. They need to be acknowledged. They need to be tested for, and they need to be considered moving forward for the rest of one's life, because these genes may not be a problem at early in their life, but they can become a problem later in their life. And so we need to know about them, period. Or maybe they will be a problem early in one's life, and people are just not aware of them. And there's things you can do to protect these kids in adolescents and teenagers and adults from these health problems. So know about the celiac genes. Keep a close eye on labs and clinical manifestations of celiac type issues. These people are more likely to have autoimmune diseases. Celiac disease is an autoimmune disease. We need to know about this early on. The last gene that I want to focus on and discuss today, as far as kids needing to have this checked for, is the FADS2 gene. FADS2 is a gene that will decrease your ability to make DHA and arachidonic acid. Now, these are like fatty acids that are building blocks for the brain. DHA is an omega-3, which is more the anti-inflammatory. So the omega-3 fatty acids are DHA and EPA. The key one for brain development is DHA. EPA is more important for decreasing inflammation, cardiovascular health, that type of stuff. They're both important omega-3s. This gene is specifically more geared towards the DHA part, omega-3. And if you have this gene, you're not as capable of making DHA. It also can interrupt arachidonic acid. Arachidonic acid is an omega-6 fatty acid. We do need omega-6 fatty acids for proper brain development, especially in children. So this is one reason that vegans and vegetarians that are higher risk for not getting enough of these fats, because they're largely found in animal products, beef, fish, etc. And it's really important that you make sure that these kids are getting plenty of omega-3 fatty acids and even arachidonic acid early in their life. So people that have the risk allele for this gene, they don't make that DHA as well. And then they don't have that building block as well for their brain. Their neurological development decreases, their IQ decreases. Even DHA is important for retinal health. They might be at increased risk for like age-related macular degeneration and vision problems as they get older. So kids that have the 2 risk alleles for this genotype, I just basically copy and pasted this out of my first book, Genetic Testing, Defining Your Path to a Personalized Health Plan, if you want the resource. So, but children that have the 2 risk alleles that were breastfed had higher IQs than children that were formula fed, because there's more omega-3 fatty acids and arachidonic acid in the breast milk. So it's really important that all kids are getting plenty of these fatty acids, but particularly important for kids that have these risk alleles, because it's going to affect their IQ. Now, the kids who make the omega-3 fatty acids better, if you breastfeed them, they're going to have even higher IQs because they're going to be getting even more DHA. So wouldn't it behoove one to just give all children DHA. In my opinion, I think it's a great way to, do a small task today, invest, a small amount of money in a bottle of high quality DHA today for a child to potentially increase their IQ in the future. I think that's a cost benefit analysis that I'm more than happy to make personally and as a parent. And so, just looking at these genes and not only looking at them from the perspective of the child, but also looking at them as this perspective of like a pregnant woman. We need to know if pregnant women have these genes because they, need to also make sure that they're getting plenty of good fatty acids during pregnancy to ensure that not just their brains are able to stay healthy, but the developing brain of the fetus is able to get everything it needs to be healthy. So the next thing I want to talk about is primitive reflexes. So primitive reflexes are a natural part of development. Everybody is born with these primitive reflexes. They are vital for our development as a human being, for our survival. But they do need to all go away by a certain point. They pretty much all need to go away by 1 year of life. And if they do not go away by 1 year of life, then that is a sign that the brain has not matured correctly. And that lack of brain maturation, or maybe some type of a trauma that prevented the brain from being able to inhibit those primitive reflexes, is revealed itself often by the primitive reflexes continuing to show up. So these are tests that, for the most part, you can do on all different ages, and you will see them. You'll see them in all positive in children, and then all of them will go away or should go away. Now, in many people, they don't go away. And that is a sign, like I said, that the brain is not as healthy as it should be. And it's basically you have a glitch in the nervous system. This is like a glitch in the computer program that is slowing everything down, making it not work as well. In some cases, it's a matter of them not going away. In other cases, it's a matter of them going away and then there's some type of a trauma and they come back. Regardless of them not going away or coming back, the end result is that you still have those primitive reflexes and you need to get rid of them. And getting rid of them through proper exercises and eliminating environmental triggers that are causing those primitive reflexes to sustain is key for making sure that brains are healthy. So primitive reflexes are these automatic movements that your brain does. They come from the brain stem, which is like an old, reptilian part of the brain that it's just automatic. And it's just part of natural brain development. So if you think of a reflex, think of somebody hitting your leg with a reflex hammer and your leg shoots out. You didn't have to think about it. It just happened. Primitive reflexes are like that. And it can be as simple as, like, for a baby, if you put your finger in a baby's hand, then, or if you put your finger in a baby's hand, their hand will close around that finger. That's the palmar reflex, okay? And so that's important to assist the baby's grasp. And then the hand will close. And then eventually around age 5 to 6, that should go away. If that reflex doesn't go away, then that can create issues with being able to properly hold a pencil. They might have poor fine motor skills, poor dexterity, poor handwriting. Now, these are real consequences. The real consequences could be inability to focus and sit still, ADHD, inability to, stop peeing in the bed. That can be a result of not getting rid of the spinal galant primitive reflex. It can be a startle reflex where you just inability to not get startled by something. And so there's lots of different real life consequences to retaining these reflexes. And the first step is to be aware of them and test them. Now, for the purposes of this, I haven't created a full analysis of how you need to test them and treat them. That's something I'm working on putting together in the future, maybe on like a YouTube video. I'll I'm working on that. But for the purposes of this workshop, I just wanted to introduce you to this concept and help you understand it, because I'm going to build on this concept over the course of this webinar. So anyways, it's important to be able to know what these reflexes are, how to look for them and test for them in all ages of the population, and how to get rid of them. And exercise is key for getting rid of these reflexes. One reason that we're seeing more of these reflexes is because kids are not as active as they used to be. They don't exercise as much as they should. And so they're just more likely to have these glitches remain in their nervous system. There are many other reasons. That is just one reason. So another reflex I didn't have on that sheet was the Babinski reflex. So the Babinski reflex is where you just take a sharp object along the lateral outside part of the foot, and in a normal response after age 1, the toe will go down. In an abnormal response, the big toe will go up. That's a positive Babinski. It is normal to have a positive Babinski before age 1. It is abnormal to have a positive Babinski after age 2. I have never seen anybody with Parkinson's disease that did not have Babinski positive. So, and there's many other neurological problems where they're more likely to have these primitive reflexes, including Babinski. Kids who run on their heels, they are going to be more likely to have a positive Babinski. And part of that is just this reflex is causing their foot to go in a manner where they're going to run on their heels. If a child is not running properly, there is a neurological problem there. And you can see it in their gait, you can see it in their running. And it's not just about them not being athletic, it's about their brain not working as well as it should. And we need to normalize testing for these, getting rid of them. And unfortunately, that is not a normal part of a pediatric exam like it should be, or, just the current medical status quo. But that's something we need to work on, because this is crucial, not just for kids, but all age groups. So I have, kind of a unique window into iron because I've just studied it so in depth for a long period of time now. And I was wanting to introduce you guys to, my book, The Iron Curse. It's not just about high iron. I have a whole section on low iron, and that's what I really want to talk about with you guys today. I know and believe that kids need to be checked for hereditary hemochromatosis. Having said that, there are a lot, probably definitely more kids that have low iron. And I want to talk about what that looks like and what that means. And fortunately, if you get a full iron panel, which includes ferritin, TIBC, UIBC, fasting serum iron, and iron saturation, fortunately, if you get that full iron panel, then you can diagnose both hemochromatosis and iron deficient anemia simultaneously. And that's really a cost-effective, important thing to do, because the full truth is a full iron panel is not very expensive, $30, $40. It's not that expensive. It's just not normal for doctors to order it. So we need to make sure we figure out if these kids have these hemochromatosis genes. If they do, you need to make sure that the pediatricians are ordering these full iron panels. If they don't, you need to make sure these pediatricians are ordering the full iron panels. They are more likely to have low iron. Let's talk about low iron for a minute. So all of this is basically from my book, The Iron Curse. And a lot of it, I'm breaking the rules here. I've been told don't put too many words on a slide, and I'm breaking the rules here because I think these words are really important, and I didn't want to water it down too much. So these are just small excerpts from my book. So having retained primitive reflexes after the age of 1 can disrupt natural development and can lead to social, educational, and motor development problems. This could appear at as anything from poor handwriting to peeing in bed to ADHD or worse. Okay. The reason I'm talking about this is because if you are low in iron, you're more likely to have retained primitive reflexes, meaning those reflexes did not go away. So then you look here. It says low iron has been linked to many health problems, including fatigue, pale skin, increased heart rate, shortness of breath, decreased ability to detoxify, headaches, poor circulation, inflammation of and sores on the tongue, brittle nails, restless leg syndrome, immune problems, developmental delays, lower IQ, decreased resistance to infections, ADHD, anxiety, depression, sleep disorders, psychotic disorders, brain fog, memory loss, hair loss, retained primitive reflexes, and Tourette's. This is all in the research. So it's important. It's important because iron is required for carrying oxygen throughout the body. And if you don't have enough iron, that means you're not going to have enough oxygen going throughout the body. And if you don't have enough oxygen going throughout the body, then that's like trying to, run a gasoline powered car on empty. It's not going to work. You're not going to be able to get anywhere. It's not going to work. If you don't have enough oxygen going throughout your brain in the early days of fetal development, because your mom is iron deficient anemic, or other reasons that I'll discuss in a second, then your neurons are not going to be able to develop like they should. You're not going to be able to make the neural connections. You're also not going to be able to do neural arborization, which is where they get rid of the connections that they don't need, so they can really just like consolidate into the most important connections. And ultimately what that looks like is a lower IQ. Brain-based disorders that are associated with iron deficient anemia during pregnancy include ADHD, autism spectrum disorder, low IQ, developmental delays, and decreased brain maturation in the child. These are huge. These are huge. And unfortunately, there's this window of time, the first 30 weeks of pregnancy, where if the mother doesn't have enough iron, or just for other reasons they're not getting enough oxygen to the infant's brain, then that can create a serious detrimental effect on their brain development, which is shown up in a lower IQ. Maternal iron deficient anemia occurring within the first 30 weeks of pregnancy is associated with a significant increased risk for autism spectrum disorder, ADHD, and particularly intellectual disability. Now, how many women do you know develop or have low iron during the first 30 weeks of pregnancy? Almost all of them. Even the women that have the hemochromatosis gene, iron is completely depleted due to pregnancy. Building a placenta, creating a child, maintaining your own maternal blood supply is a heavily iron depleting combination of events. One of the reasons that these genes that cause high iron in today's society exist, one of the reasons these hemochromatosis genes exist, is because they protected women from iron deficient anemia during pregnancy. Iron deficient anemia during pregnancy is one of the gauntlets of evolution. It has killed many women. It continues to kill many women in third world countries. It has killed many children. It is a huge issue. It is easily diagnosed. It is easily treated. It is a huge issue that's not being looked at properly. Women need to know and know their iron levels going into pregnancy, and they need to make sure that they're watched closely during pregnancy to make sure that they have healthy iron levels, not borderline low, because if they go into pregnancy borderline low, it's only going to get lower. And you don't want to wait. And what I see often is women, they'll be far into anemia before their doctor even mentions anything. And then it's like they can't get caught up. And oftentimes they end up with an iron infusion, which there are issues with. I'm not going to go into today, but there are. You have to trust me on that. So this is an issue. This is a serious issue. So going on, children that experience low iron will develop children that experience low iron while developing in utero experience an increase in cognitive and behavioral deficits. Women with moderate anemia had a 59% greater chance of having a child with an IQ below 70, that is low, folks, at 7 years of age. So it's not just about them having a low IQ coming out when they're born. It continues for the rest of their life, potentially. Infants born with low iron stores have abnormal neurological processing when measured at 5 years old. Studies in rats have shown that iron deficiency early in pregnancy will create long-term deleterious behavior and developmental problems that are not reversible with treatment with iron. Moving on. What does this mean? Remember how I talked about not just low iron can create these issues, but low decreased oxygen, period. You don't have to just have low iron to have these issues. It's all about not getting enough oxygen to the developing fetus brain. What are some other issues that can cause the developing fetus brain to not get enough oxygen besides low iron? High blood pressure will constrict the blood vessels, decreasing blood flow to the brain. Not just the baby brain, but the adult brain too. Smoking, gestational diabetes, and premature birth. Combine them? Well, for example, pregnant women who have both low iron combined with a metabolic condition like diabetes that decreases oxygen to the brain are at a 5-fold increased risk of having children with autism spectrum disorder. That's a lot. And this is, like I said, something that is diagnosable, preventable, treatable. We're failing. Moving on, iron in kids. Now, I just talked a lot about iron during pregnancy and how that affects children. Now let's talk about ADHD in kids. So from my book, The Iron Curse, I like this sentence, so I'm going to say it. Forgive me. Expecting someone to have a healthy brain and the ability to focus without adequate nutrition and exercise is like expecting a plant to grow and thrive without adequate water and sunlight. We can give the plant expensive, side effect-ridden pharmaceuticals to help it survive in an unhealthy environment, or we can just give the plant rich soil, water, and sunlight. This is one of my biggest pet peeves that I see constantly. Doctors, parents, they're comfortable with giving a kid like a stimulant for their brain to help with focus. But they're not talking about, well, why don't we get all of the food coloring and the sugar and the excitotoxins like MSG and aspartame out of their diet? Why don't we make sure they're getting plenty of protein and healthy fats? Why don't we give them DHA, which is crucial for brain development and focus? Why don't we make sure they have plenty of vitamin D, healthy guts? Why don't we look at all of these environmental factors before we just throw a stimulant at their brain to help them focus? It drives me nuts, but that's basically what that sentence is saying. And specifically to iron, if we know that kids that have low iron are more likely to have ADHD, which they are, then why aren't we looking at their iron labs? Why are pediatricians not ordering iron labs before diagnosing a child with ADHD and giving them medications? Children with ADHD have been shown to have statistically lower levels of serum iron and ferritin, ferritin is stored iron in the blood. A child with blood work showing low iron and ferritin is more likely to have ADHD, and the severity of ADHD is likely to be worse as iron and ferritin levels decrease. The lower the iron, the worse the ADHD. It's obvious. They don't have enough iron. They don't have enough oxygen going to their brain. They can't focus. Rather than saying, focus, work harder, take this drug, why don't we just say, hey, we're going to give you the iron so that you'll get oxygen going to your brain? And isn't that a beautiful thing to have oxygen going to your brain? Maybe the pediatricians don't have enough oxygen going to their brain. I don't know. The children with the lowest iron levels were shown to be the most inattentive, impulsive, and hyperactive. The lower the iron, the worse. The ADHD. Some research suggests that low iron may explain as much as 30% of ADHD severity. Some research suggests that low iron may explain as much as 30% of ADHD severity. That is huge. What if 30% of kids that have ADHD actually just have low iron? That's what the research is suggesting. Why do we not test kids for low iron before giving them a drug for ADHD? If this is true, then we are misdiagnosing children with ADHD and giving them amphetamine stimulants when they may just need iron. Okay. Now, I just talked a lot about low iron. Now I want to talk about high iron in the brain. Now, I talk about high iron a lot in the Iron Curse. For the purposes of children, what I really want to just kind of give you today is this one kind of idea. High iron does happen in kids. It does not get diagnosed properly because a lot of things don't get diagnosed properly. It's easy to diagnose and screen for with genes and lab testing. What I want to present to you is a research study called The Relationship Between Type 1 Hereditary Hemochromatosis and ADH Symptoms with Adolescents Using Mental Health Assessments and Neuroimaging. You can find this on the internet. And what they found was that there was not an association between hemochromatosis and ADHD, but what they did find was that there was damage, there was more iron deposits in the putamen and the caudate, which is part of the basal ganglia, on an MRI of these 9 and 10-year-olds. Now, the basal ganglia is the part of the brain that is associated with Parkinson's. So when the basal ganglia gets damaged, that can create Parkinsonian type tremor, the whole issue. What this research study is saying, and what I think is true, is that potentially what we are seeing on these 9 and 10-year-olds on an MRI of their brain, where they have too much iron in the basal ganglia, could be the prelude to Parkinson's later in life. We know, without a fact, that high iron hemochromatosis causes Parkinson's in many people. Not everybody. It causes different symptoms in everybody, but it certainly can cause Parkinson's. If you see a lot of iron deposits in the basal ganglia, that is common. That's creating an issue. It's creating oxidative stress and damage, and that can cause Parkinson's. We know that. We know that. Now we have clinical MRI empirical evidence that shows that these kids with hereditary hemochromatosis have more damage to their basal ganglia from iron. They have more iron deposits. And while they don't have a tremor, that might be the prelude. That could be coming down the track. It might be another 5 decades, 4 to 5 decades, but that could be the future of these children. So my point is, get the genetic testing done early. Get the lab testing routinely. Find and avoid genetic landmines. Now, kids need lab and genetic testing too. Often, I will find situations where parents are hesitant to do the lab and genetic testing. And I, have multiple ways of kind of explaining that to them, and some people choose to, and some people don't. The fact is, in my opinion, most pediatricians are not doing thorough enough testing. Whenever I do order a full blood test on a child, I always find something, whether it's low vitamin D, high eosinophils, which is very common because there's a lot of allergies in children. And if you see high eosinophils on children or in anybody, it can be because of allergies. It can also be because of a parasite. Sometimes it can be hard to know for sure which one it is. You can get a stool test to see if there's a parasite. You can do some allergy testing and then get off the allergic foods and see if the eosinophils go down. We did that in my daughter and it worked. Got her off of dairy and eggs and her eosinophils came down. She got back into dairy and eggs and eosinophils went back up. Got her off of those foods again. They went down. See my point? So what are some other labs that routinely come out of range on kids? Let's see. Vitamin D, eosinophils, iron. It's often low or high. Thyroid, it's very common for me to see a thyroid type issue on kids that's not being diagnosed. Low thyroid is going to decrease the ability to focus. Lots of CBC type issues. My point is that kids need to have these labs done too, and they're not getting done like I think they should. And that's something that I want to help change. Kids also need these genetic tests. And if nothing else, just look at the genes that I told you about in the first slide of this presentation. Now, if we're going to talk about brains, let's talk about developmental milestones. Now, unfortunately, we live in a world where more kids are not meeting their developmental milestones. And instead of acknowledging that and saying, we have a problem, the CDC has updated the developmental milestones to make it so that the bar is lower. So rather than, screaming, we have a problem, we need to figure out what it is and change it, they're saying, let's lower the bar so that not as many kids are not meeting their developmental milestones. And it's crazy, folks. So the most crazy of all is the fact that they removed crawling as a developmental milestone. Crawling is one of the most important developmental milestones there is. You don't have to be a pediatrician, neurologist to know that. Crawling is key. That's why parents often talk about what age their kids start crawling, and they get concerned if their kids are not crawling by a certain age. The previous 2021 guidelines were 8 to 10 months. Now, crawling is not a milestone. So I present this to you because I think it's important to be aware of what the previous guidelines are and live by those, but also for you to understand that, unfortunately, the bar is getting lower, and I think it means that parents are going to have to be more involved, and doctors are going to have to just be willing to go against the status quo because it's what's in the best interest of their patients rather than what is, the guidelines. Now, another thing I want to talk about, and I kind of have a unique piece of information here, so I wanted to include it because I think it's important. Having said that, it's a little bit emotional. So basically, the idea of trauma. Trauma is key for the developmental brain. It's key for a healthy developmental brain. It's crucial, the timing of the trauma. It's not something that gets talked a lot about. I'm not going to go into great depth, but I did want to cover it a little bit because I think I have some unique information to give that's relevant. And so here's the spiel. There's a James Fallon, he's the author of The Psychopath Inside. And he has this saying, it said, real nurture can overcome a lousy hand of cards dealt by nature. And that is true. So, real nurture is like taking care of a child, having good parents, having good grandparents, having a good social network for children. That can overcome bad genes that might predispose one to having an unhealthy brain. However, you can, and in some cases, get both, bad nurture and bad nature. You can get the bad gene combined with the bad environment, and that is a really potentially dangerous combination. And the reason I'm going to go into that more in a second here, but this is from my first book, Genetic Testing, Defining Your Path to a Personalized Health Plan. What James Fallon presents in The Psychopath Inside, and he looked at a lot of data, was that psychopaths have three things in common. They have the MAO warrior gene, which a lot of people have and are not psychopaths. Most people that have this gene are not psychopaths. In some cases, it can be good, However, if we're looking at what these things have in common, they have these three things in common simultaneously. One is they have that MAO warrior gene. What does that gene mean? It means that they are making more serotonin, which is a major neurotransmitter in mood disorders and psychopathy. So the people that have this gene, they make more serotonin. And in utero, what happens is their brain is being so inundated by serotonin that they effectively start becoming desensitized to serotonin. And the parts of the brain that would normally get turned on by serotonin now become basically serotonin deficit. And they turn off these parts of the brain because there's too much serotonin that it's just like it's overwhelmed and it stops responding to serotonin. It downregulates the serotonin receptors. This is analogous to like an insulin resistance when the body's creating so much insulin that the cells are like, I've had enough. I'm tired of you, insulin. And that removes it, downregulates those insulin receptors off of the cell membrane, and it stops responding to insulin, and that's insulin resistance. In the case of what I'm describing here, it's like serotonin resistance. The brain stops responding to serotonin because there's too much serotonin, maybe because of the gene combined with maybe, an SSRI being used by the mom or alcoholism by the mom. For some reason, there's too much serotonin, and that baby brain, infant brain, is turning off that part of the brain, especially in the second and the third trimesters. Okay, so that's one thing that's going to dramatically change the brain development, and one of three components that happen simultaneously in psychopaths. The second part is trauma. It can be physical, emotional, or sexual. It can be neglect. It can be the death of a parent. It can be alcoholic parent. It doesn't have to be like a trauma you can see or hear or feel on the outside. It can just be that child perceives it as trauma. And not all children perceive things the same, but for some children, it's enough to be a severe trauma exposure during the first 3 years of a child's life. If all of these psychopaths, they had the MAO gene, they had a serious trauma during the first 3 years of the child's life. And abuse during that time, and doesn't have to be like abuse intentional, it can be like a parent died, can cause irreversible damage to the brain, particularly to the frontal lobe. Damage to the frontal lobe of the brain is always seen on the PET scan of convicted psychopaths. And this Dr. Fallon, his research found that all convicted psychopaths had experienced abuse as a child, and many had lost one or more of their biological parents. So they have this gene that makes them have higher levels of serotonin. They've had a serious trauma in the first 3 years of their life. Now, what happens in the first 3 years of your life? I learned this from Dr. Malillo. He's a really brilliant doctor. He wrote Disconnected Kids. The first 3 years of your life is when your right side of your brain is developing. The right side of the brain develops for the first 3 years of your life. And then at the age of 3, the left side of the brain starts to develop and take over. So the right side of the brain, if you experience these serious traumas while that right side of the brain is developing, that is a window of time where the brain cannot necessarily fully recover all of the time. And I'm not saying it's not possible with the right techniques and therapies and everything. I'm just saying that the trauma happening while that first 3 years of the life, while the right side of the brain is developing, is a critical window of time for the trauma to happen, especially if you look at that combined with the MAO gene. And then the next thing I'm going to tell you in just a second. So the right side of the brain develops for the first 3 years of the life. That's, children typically shouldn't have memories that they can recall until after age 3, when they put that into the left side of the brain. The right side of the brain is more subconscious. You shouldn't have any memories from before 3 years of your life. The right side of the brain is the part of the brain that feels empathy. The right side of the brain is the part of the brain where you really feel your body. Like you largely feel your body in what's called the insular cortex on the right side of the brain. The right side of the brain is largely what kind of gives you control over your body. So left side of the brain, also very important, has a lot to do with, fine academic skills like language, reading, phonics, math, etc. They're both important. Both sides of the brain do not always do the same things. They do not do the same thing simultaneously. They often will suppress the other side so they can do what they need to do. So moving on, we talked about 1 and 2. Number 3, these psychopaths, they looked at their brain, and not only did they have the MAO gene combined with the trauma, but when they looked at their brain, they had damage to one of these 3 parts of the brain: the frontal lobe, the amygdala, or the insula. So the insula is like deep in the brain. That has to do with a lot of empathy, self-awareness. The amygdala has to do with the limbic system, which is, like a very reptilian old part of the brain that has to do with kind of your ability to regulate your emotions. And so these psychopaths, they had a shrunken amygdala, which is considered to be more common with people that are like quick to anger. And then, of course, they had a lesion on their frontal lobe, which the frontal lobe is really, the orbital cortex is really key for ethical, moral, controlled decisions. So it's almost like these kids, they were kind of like given the completely wrong set of cards, and it's like the decision had been made for them before they could even, consciously control it. I'm not saying that that's necessarily 100% of it. I'm just saying that my point is that trauma is a very real and important part of brain development and brain health. And my point is that nurture for one's whole childhood, but particularly that first 3 years of life, is a key, crucial part of having a healthy brain for the rest of your life. And it's really important that we as adults rally around these young children and protect them, period, particularly during the first 3 years of their life when they are the most vulnerable to abuse, because they can't defend for themselves or speak for themselves. And so that's my point. Now, we're going to kind of change something a little bit light here for the last part. The gut-brain connection is crucial for children's brain and immune systems and for health to develop properly. We need to normalize talking to children about bowel movements. You need to talk to your kids and your patients about, how was your poop today? Was it solid? Did you poop? When was the last time you pooped? Go into the bathroom and watch them and look at their poop. That is totally an acceptable, normal thing to do. And what I have found as a clinician is that often I'll talk to a child about their gut, and the parent, I'll say, have you had any gut problems? Like, are you having any stomach pain, or you have any diarrhea or constipation? And they don't even know like what constipation is half the time. I have to explain it. And the parent will, say, no, they're fine. They don't have any issues. And then the kid will say, well, actually, I do have some problems. And it's like, okay, you don't know what's going on with your kid because you're not talking to them about this. And you need to talk about it because it's crucial. And kids, they're not going to often just come and say, hey, I didn't poop today. You need to talk to them about it. You want your kid to have a healthy brain, they need to have a healthy gut, because the gut-brain connection is real. So let's talk about the gut for a second here. Probiotics are key. Everybody needs to be really aware of probiotics and taking probiotics, especially pregnant women, children. I believe, based on the research, that infants really need to start taking probiotics day 1. Pregnant women need to be taking probiotics throughout pregnancy and after. It's key. It's the seeding of the gut microbiome, of the body's microbiome. Is, the mother's vaginal flora is going to seed that child with good bacteria, hopefully, or it's going to seed that child with bad bacteria if that's what it has to give. It's going to give what it's got, so give it something good. Take the probiotics. Don't feed the bad bacteria with sugar. Avoid antibiotics as much as possible, but take them if you need them. If you have a child with strep throat, take the antibiotics. That can create serious issues down the road if you don't just get rid of it. You don't want a kid with pandas. If you have a kid with Lyme, take the antibiotics. You can do all the herbal stuff with it too, but get rid of the infection fast. Don't let it sit around and create long-term problems. Having said that, you got to protect your kid from getting too many antibiotics, because it is very common that antibiotics will be overprescribed for things like viruses. It is very common. And I almost had this happen to my daughter when she was itsy bitsy little infant. She had this virus that caused like 3 weeks of diarrhea. She was, I think, like 9 weeks or something. She was so young, such a little, infant. And she just had this diarrhea that started one day, and it just went on and on. And I kept taking her to the pediatrician, and I was like, well, we got to do a stool test and figure this out. And so they botched the stool test, and they said, well, bring the diaper in and we'll collect the sample. And it's like, well, it's diarrhea. So they didn't collect the sample because there was nothing to collect, because it had all gone into the diaper. So eventually they gave me, the test to take home. So I did the test and I took it back. And then, the whole thing took way too long. And in the interim, before we kind of had the answers and the result that it was a virus, in the interim, the nurse practitioner was like, I think it's a parasite. You need to give him metronidazole and kill this parasite. And I was like, I don't think I'm going to do that until I have like a stool test that's going to show me. I'm not going to give my baby metronidazole. That's a hardcore antibiotic. But I was scared. And, part of me felt like, oh my God, am I doing something wrong by not giving my child this, hardcore antibiotic? But no, I was right. It was a virus. The stool test came back. It showed it was a virus. But had I not held out, like the doctor, the nurse practitioner was telling me to get the antibiotic. She had called it in. After she got the results, she was like, hey, did you give your child that antibiotic? I'm like, no. She's like, sorry about that. So the point of the story is, you've got to protect your kid from over antibiotics, but you also need to be mindful about there is a time and a place where they do less harm than just letting a infection linger. Don't over clean, but please clean your child. Don't bathe infants for at least the first 24 hours. Don't bathe more than one time a week. These have been shown to be helpful for good skin biome. Take, probiotics that are good for the skin. Breastfeed as much as possible. Babies are born with a naturally leaky gut because babies don't have an immune system that naturally makes antibodies until they're about 6 months old. Their immune system just doesn't work to make those antibodies like they should and will and could as they get older. And their immune system has a leaky gut to allow those antibodies to go through the gut from the breast milk, because breast milk has all those antibodies in it to protect the baby from getting sick, which is why breastfed babies are less likely to get sick. But breastfed babies are also less likely to have a leaky gut go on for a long time. So breastfeed if possible, educate people about the benefits of breastfeeding, and probiotics, avoid antibiotics, etc. I'm just going to leave this here. I'm running out of time, but this is just Texans for Vaccine Choice. So there's just showing you 1983 doses versus 2021 doses. Talk to your doctor, do what's best for you. Just wanted to show you that. And then immune support, consider glutathione, zinc. So in vaccines, they have mercury in them as an adjuvant. They have aluminum in them as an adjuvant. And mercury depletes glutathione, zinc depletes aluminum. So you might want to consider those if you do decide to give somebody a vaccine. It's always good to have lots of, glutathione and zinc. Probiotics are key for supporting immune tolerance. Vitamin D for supporting immune system tolerance. DHA supports brain health. I think, multivitamin, mineral, I think pretty much everybody, it's a good insurance plan. The guidelines are to not give vaccines while sick or with a fever, so be aware of that. Work with your doctor to discuss one at a time rather than a bunch. Watch closely for side effects if you do decide to vaccinate. If you do vaccinate and give your child Tylenol to get rid of a fever, you will be further depleting glutathione because Tylenol depletes glutathione. So you need to make sure they have plenty of glutathione going into and throughout the process. Motrin causes leaky gut, so you need to be making sure that gut's healthy. Support detox pathways with, methylation, glutathione. Make sure there's plenty of antioxidants and reduce oxidative stress. Glutathione's a key antioxidant. Here's some research articles that show that autism is related to low glutathione, low B vitamins, methylation, oxidative stress. Look at those if you choose to. I'm going through this quickly. This is the amount of sleep kids need. They need a lot of sleep. Sleep is key for the brain health. Let's all sleep more and make sure that we feel good in the morning. Let your kids get dirty out in nature. If you over-sanitize your child, they will be more likely to have autoimmune diseases. So they need to get dirty. But, you also need to make sure they're not getting parasites and maybe consider a stool test. The battles are lost and won at the grocery store. Be an example. Do not let them eat a lot of sugar, please. I'm going to summarize things here and then I'm going to move on and I'm done in give me 2 seconds. What do I think all kids need as a supplement? DHA, probiotics, multivitamin, D3, K2, consider glutathione, zinc, iron as appropriate. Other crucial things, I think we need to rule out food allergies, consider a stool test, get labs and genetic testing done, go outside and play, exercise, get plenty of sleep. You as an adult need to set an example. Avoid excitotoxins, MSG, aspartame, food coloring, inflammatory foods, limit sugar, caffeine, glyphosates like Roundup, pesticides, chemicals. Make sure that they're eating a diet rich in fats, protein, vegetables, and fruits. And immune exposure is crucial for development. So we can't let them just live in a bubble. They have to go out there and get sick. It's just part of being healthy. My upcoming book, The Iron Curse, is coming out soon. That's my first book, Genetic Testing, Defining Your Path to a Personalized Health Plan. Feel free to stay in touch on Instagram and social media and all that junk. And thank you for your time. I look forward to seeing you next time. Have a wonderful day.